All right, good morning, everyone. My name is Savannah Holt. I'm the Sexual and Reproductive Health Program Coordinator with the Saskatchewan Prevention Institute. The Prevention Institute is a provincial nonprofit organization that's located in Saskatoon on Treaty 6 territory and the homeland of the Métis Nation. Our organizational focus is to reduce disabling conditions in children using primary prevention methods. We raise awareness by providing training, information, and resources based on current best evidence. We believe that all children, regardless of ability, have the right to the best physical, social, and emotional health possible. We work in a variety of areas, including sexual and reproductive health, fetal alcohol spectrum disorder prevention, maternal and infant health, early childhood mental health, child injury prevention, child traffic safety, and parenting. One focus of the Sexual and Reproductive Health Program is to provide evidence-based information on sexual and reproductive health that is accessible to health educators and to the health that they work with. Saskatchewan youth have high rates of sexually transmitted infections and unintended pregnancy. Providing comprehensive, sex-positive, and preventive sexual health education helps youth build the skills, confidence, and attitudes they need to make healthier choices. Understanding the complexity of human sexuality can help us share this information with young people in ways that are relevant, culturally safe, and respectful of values and identity. Here to talk about human sexuality today is our speaker, Natalia Mason from Saskatoon Sexual Health. Natalia Mason is a sexual health educator and social worker in Saskatoon. She holds a Bachelor of Arts in Psychology from the University of Saskatchewan with a minor in Women's and Gender Studies and a Bachelor of Social Work from the University of Regina. Natalia has also recently completed a postgraduate certificate in sexual health at the University of Saskatchewan, or University of Alberta. Sorry, Natalia. She is currently completing a master's degree in Women's, Gender, and Sexuality Studies at the University of Saskatchewan. Her graduate work focuses on reducing social and emotional barriers to condom use for adolescent girls. Natalia is extremely passionate about sexual health and currently works as the Education and Outreach Coordinator at Saskatoon Sexual Health. She's a lifelong member of the Girl Guides of Canada and is dedicated to social justice and reproductive rights for women and girls. Welcome, Natalia.
Good morning. Thanks for having me, Savannah. I am super excited to get into this today. It's a lovely day for sex ed. Okay. So as Savannah mentioned, my name is Natalia Mason. I'm a sexual health educator and a social worker. I was born and raised here in Saskatoon. I'm a second generation Canadian. My dad immigrated to Saskatchewan from the Caribbean, and my mom is from the equally exotic Melfort, Saskatchewan. So she actually came from a settler family, which means that I'm a settler here on Treaty 6 territory. And I'm so grateful to be able to live here and to work here. Treaty 6 territory is the homeland of the Métis and traditional Cree territory. And the work that I'm talking about today is about sexual health, but we're also going to be talking a little bit about power. And so I think that it's really important to remember that colonialism has brought all sorts of really unhealthy power dynamics to Saskatchewan. And that part of the work that we're doing here is trying to address some of those things and unpack some of them. So that's my contribution to this work today. And like Savannah mentioned, I have studied for quite a while, and my areas of research focus usually on issues related to gender and power. And so what I'm going to be sharing with you today is some information that's about sexual health in Saskatchewan. Some of it helps us to set the context to understand what's going on better. And then some of it is musings from my thesis that I'm currently working on. So these are just some ideas that I've been thinking about lots lately. There's some new stats and information that's become available in the last year, so I'm also going to be sharing some of that. And I use the pronouns she, her. Okay, so today we are going to start with a definition of sex positivity. I think that's really important for grounding these conversations and figuring out where we're starting from. We're going to look at the key conceptual elements of sexual health, and that's provided to us by the World Health Organization. We're also going to take a look at a sexuality wheel, which is a teaching resource from Teaching Sexual Health, which is Alberta based. I've done 2 prior presentations for the Saskatchewan Prevention Institute over the last few months and have explored the sexuality wheel in both of those. So if you were present, it will likely be familiar to you, but I think that it's a really important resource and again, super important to set the context for the conversations that we're having today. I'm going to share some information, some statistics, data, that kind of thing that we have about what sex ed is. We're going to talk about an idea called comprehensive sexuality education, which isn't an idea, but actually a really specific set of defining characteristics of the best gold standard sex ed that we can offer to our learners. We'll talk a little bit about Saskatchewan's health education curriculum. So what's in there, what's not in there, where does it need improvements? I'm going to cover some data on sexual behaviors among teens. So what's common, what we see in the population. And then at the end, I'll talk about teaching effective sex ed. So how we can all become better at delivering this content to student learners. And then, as always, I have lots of resources for you, and we'll take time at the end to do questions as well. But feel free to make use of the Q&A function as well if you do have questions. I'll get Savannah to keep an eye on that for me, and she can keep me up to date on what's going on there. Okay, so talking about sex ed is one of my favorite things, which is really fortunate because it's something that I also get to do for my job. But it's a very complicated conversation. The world has changed a lot in the last decade, but even in the last year, the world has changed so much. And these constantly changing conversations mean that young people are being asked to evaluate and reevaluate and consider their sexuality from lots of different perspectives and with lots of different pressures. So when I'm in classrooms, I get questions like, if both parties are consenting, are one-night stands cool? And why do you think that somebody would want to send nude photos to somebody? So being able to address those kinds of questions isn't about having the perfect answers tucked away in your pocket. It's more about how you're positioning yourself in this conversation and what you want the outcomes for your students to be. So we're going to talk a little bit about that and how we can create more effective and engaging lessons for our students. This definition of sex positivity comes from the International Planned Parenthood Federation, and I really like it, and I hope you'll see why in a minute. It says, sex positivity is an attitude that celebrates sexuality as an enhancing part of life that brings happiness, energy, and celebration. Sex positive approaches strive to achieve ideal experiences. At the same time, sex positive approaches acknowledge and tackle the various concerns and risks associated with sexuality without reinforcing fear, shame, or taboo of young people's sexuality and gender inequality. Approaching conversations about sexual health education with a sex positive lens is critical. For a really long time, sexual health education was taught from a sex negative lens, which means that we only focused on the harms, the risks, and the consequences of sexual activity. And that kind of sex ed isn't engaging, and it's not what young people need in order to make better decisions for themselves. So keeping that sex positivity front of mind is really important. The World Health Organization has a, I guess, document, if you will, that's called the key conceptual elements of sexual health when viewed holistically and positively. And this is something that I include in all of my presentations because I think it provides a really important framework for what we're looking at when we're talking about sexual health. Because from that risks and consequence lens, we were heavily focused on STBBIs and pregnancies and not concerned about anything outside of that. And when we look at the sexuality wheel, we're going to see how many intersecting factors there are that influence people's experiences of sexuality. And so these key conceptual elements kind of just lay it out for us. So the first piece is that sexual health needs to be about well-being, not merely the absence of disease. And I kind of just spoke to that. Sexual health involves respect, safety, and freedom from discrimination and violence. We're going to be talking about this idea of respect in relationships specifically, but people who are facing threats of violence or discrimination do not have the ability to make the same decisions that they normally would about their sexual health. Sexual health depends on the fulfillment of certain human rights. So your right to inclusion, your right to privacy, your right to participation. The Convention on the Rights of the Child and the Convention on the Elimination of Discrimination Against Women both speak to the importance of sexual health and more specifically sexual health education. So these conversations are rooted firmly within a human rights context. Sexual health is also relevant throughout the lifespan. So not only to those in their reproductive years, but also to both the young and the elderly. Now, when we talk about sex ed, we're imagining talking to a classroom of preteens, maybe teenagers. And that makes sense, right? Because those students are going through big changes in their life, and it's important that they have access to this information at those critical moments. But when we teach young people math, it's not just all of a sudden one day you walk into a conversation about trigonometry. We use scaffolded learning, right? And so we teach numbers, then addition and subtraction. I'm really horrible at math, so I'm like not surprised that I can't even say subtraction. Long division, and you keep carrying on with your skills like that. When we're talking about sexual health, to set students up for the best learning outcomes, it's really important that we do that as well. So starting those conversations by talking about correct language for our bodily anatomy, talking about bodily autonomy, and eventually building up those skills. So by the time that they get to high school and we're having these conversations about their sexual decision-making, they've been primed and they have a better skill set to be able to like navigate those experiences. Diversity is also critical to these conversations. Sexual health is expressed through diverse sexualities and forms of sexual expression. So not everyone who is sexual is necessarily going to be heterosexual. And we need to remember that lots of students who are in our classroom won't identify as heterosexual. And so if we get really fixated on those traditional conversations of the penis and the vagina and the pregnancy, then we're not necessarily serving those students in the best way that we can. Gender and power. Sexual health is critically influenced by gender roles, gender norms, roles, expectations, and power dynamics. So that's the bulk of what I want to talk about today. And that's because that is my area of focus when it comes to my graduate research. The question that informed my thesis, I suppose, was, why don't young people use condoms? I'd been going into classrooms for quite some time. I knew that when I was telling young people to use condoms, I wasn't the first person who ever said that to them, but there are lots of reasons why they choose not to use condoms. And those reasons aren't usually because they don't know where to get them, or they don't know how to use them. It usually has more to do with the relationships that they're in, the power dynamics, their gender, than it does with lots of other factors. And so being able to look at that, to address it, and to think critically about it allows us to provide students with better strategies to negotiate their safer sex practices. And then the last piece is that sexual health needs to be understood within specific social, economic, and political contexts. And this is also incredibly important. Sexual health is not necessarily a super massive community. And so often we'll have like one or two organizations in a province, and larger centers like Montreal, Toronto, Vancouver often have louder voices in lots of these conversations. But when we're delivering this content in Saskatchewan, it is really important that it's informed by the context. And so we're thinking about, the impacts of residential schools, ongoing trauma related to that. We're thinking about rural farming communities, and how those values have informed these conversations. And as promised, here is the sexuality wheel. So this sexuality wheel is a resource from teachingsexualhealth.ca, which is an Alberta-based resource. And I return to it time and time again because it lays out all of the influencing factors that are related to people's sexuality. So in the past, thinking about sex ed was very much penis and vagina, and that was kind of like the whole focus of the lesson. And it wasn't necessarily getting into all of these complex factors that people are actually experiencing when they're thinking about their sexuality. So in order to be effective in providing sexual health education, we need to be able to understand that all of these factors have an influence on behaviors and on decision making. So at the top, we have values, right? And I spoke about the Saskatchewan context. So Saskatchewan is a fairly conservative province. We are a Western kind of country. And so what that means is that we have lots of values that are tied to Christianity, to Eurocentrism, that kind of thing. And even if those were not the values that your family grew up with specifically, you're growing up in a society where that's the majority of the values that are present. And so that will have an influence on all learners. So those are values related to things like, saving yourself to marriage, and values around purity, that kind of thing. Values are things that we do pick up from our family, from our friends, from the world around us. The next thing is relationships. So the relationships that we have with family, with friends, the relationships that we see modeled to us. Sexual activity. And so that is the actual penis and vagina, what's happening with the genitals. And like I said before, people tend to get really hung up on what's going on with the genitals, but it's a really small piece of the conversation. The next piece there is communication. So the communication skills that I have seen modeled to me, the communication skills that I grew up with in my household, how I learned to communicate with partners. My number one pro tip as a sexual health educator is that communication is one of the single most important skills that young people can have. And so I spend a lot of time talking about the importance of communication, of improving it, the fact that it is a skill, which means that it's something that we can practice and get better at. And I'll get questions like, how can I make sure that my partner's enjoying themselves, or how can I be a better lover? And I always tell the students that the answer to that question is communication. You have to talk to your partner. If you want to improve your relationship, you have to talk to your partner. And so communication is a really, really critical piece of our sexuality. The next is socialization. And so socialization is what happens to us when we get up and we leave the front door of our house every day. Socialization can be helpful. If you're walking around downtown and you're picking your nose, like probably people are going to look at you. They might eventually say something. You might get a couple of grosses, right? That's pretty helpful. There are lots of reasons why picking your nose in public is not really acceptable, reasons related to hygiene, etc. Socialization can also be really harmful though, right? If we think about our gender roles, if you were a person who was assigned male at birth and people see you walking around in a dress, you're also likely to get comments and stares and looks. And sometimes that socialization can end up being really violent. And so it's important to understand that like socialization is a process that tells us what is okay and what isn't okay and what's acceptable and what's not acceptable. But it's not necessarily a process that is like moral or just. It's just kind of something that is happening to us. The next piece is self-image. And so this is kind of the area where I like to talk about the way that these things all influence one another. So your self-image is based on, other people's perceptions of you and how you internalize that and how you understand it. So you've likely picked up values in the process of socialization about what beauty is meant to look like, about what bodies are meant to look like. Those things can lead you to develop a positive or a negative self-image. Having a negative self-image makes people more likely to have more harmful experiences. And so one of the things that I always like to talk about here is pornography specifically. Now, I am not anti-porn. I think that porn is just porn. It's not inherently good or inherently bad, but I do think it's a reflection of the society that we live in. And so if you live in a society that's misogynistic, that is violent, that is aggressive, then you see those values in the media that's produced. And so that is a large portion of what we see in the pornography that is produced in a Canadian context. And I actually say Canadian context because a large majority of the pornography that is produced in the world actually comes out of Canada. It's not necessarily filmed in Canada, but those production companies are almost all in Montreal. Fun fact for the day. So in pornography, we see the same kind of bodies being represented over and over and over again, right? And so if you see a body represented or your partner has seen lots of pornography and then they look at your body and they say, hey, that's not what those genitals are supposed to look like, that can lead you to develop a negative self-image. That can lead you to have negative experiences. And that's also leading to an increase in an elective surgery called labiaplasty, which is where a doctor is changing or surgically adapting the size and the shape of the labia. And there's no medical reason for anyone to ever need that kind of surgery. And so we can see that that increase is pretty directly correlated to the availability of pornography. And those are really critical conversations that we need to be having with young people. Because there's nothing that we can do to stop them from seeing pornography. Research would suggest most young people have seen pornography by the time that they're 11. But we do need to be able to equip them with the critical thinking skills to think about what they're looking at and be able to recognize that pornography is a production just like anything else. So sex is your biology. Sex is determined using 3 specific factors, one being anatomy. So the doctor looks between your legs when you're born and says, this is a boy or this is a girl. The second thing being hormones, and the third thing being chromosomes. And so people love for things to be really black and white. It makes them easier for us to understand, but even something that seems as simple as sex, as male or female, is not always that simple. Sometimes people are born with genitalia or hormones or chromosomes that are somewhere in between male or female. And so those are also conversations that we need to be prepared to have. The next piece is sexual orientation. So who you're attracted to, who you want to have sexual experiences with. Students who are not heterosexual still need to have information about their sexual health practices. And so we need to be prepared to answer those questions as well. And then on the left side there, we have gender expression and gender identity. And so those are how we indicate our gender to the outside world. Gender expression might be indicated through hair, through clothing, through nails, manner of speech, the way that you sit, all of those things. Gender identity is how you understand your gender yourself. And so sometimes for some people that is directly correlated with the sex that they were assigned at birth. That would make that person cisgender. And sometimes they are not aligned with the sex that you were assigned at birth. And so that might make someone transgender or non-binary. And then the last piece at the top there is personality. So just like who you are and what you bring to this conversation. So when we're talking about being effective sexual health educators, we need to keep all of these things in mind. And I know that that seems like a massive juggling act, and it is, but that's the only way that we can do our due diligence here. So what do we know about sex ed? What does the research tell us? The first lesson is that young people want guidance on more than just the birds and the bees or how to put on condoms. And I'm going to talk more about that. The second is that teachers feel nervous or unprepared to teach these subjects and move away from simply talking about risks associated with sexual activity because of what they perceive to be their own lack of knowledge, skills, confidence, or comfort. And that's perfectly understandable. I've spent some time talking to students who are in the education program at the U of S. And from my understanding, there's not necessarily a lot of time spent on teaching effective sexual health education. And so if educators have never been provided this information and these skills, then it makes sense that they wouldn't necessarily feel super comfortable delivering this material. The third lesson is that educators are nervous and hesitant, particularly around conflicting views. And so not being certain how to negotiate these kinds of conversations with parents or with students in their classroom who have diverse cultural backgrounds, or also just being worried about pushback from administration who aren't necessarily supportive of these kinds of materials. And in a little bit, we're going to talk about the human rights component of this information, but there is so much research and human rights policies and frameworks to back up the importance of this content. And so it's my hope that by the end of this presentation, you're feeling more confident about delivering the content and the I guess, wealth of knowledge and also just like authority that is behind the delivery of this kind of material. And then the last piece is that young people want information on healthy relationships from an LGBTQ plus inclusive perspective. And so again, remembering that not all young people are heterosexual, and so we need to incorporate that into our lesson plans. I'm not sure what the exact study was, but I'm fairly certain that I read something maybe put up by GLAAD saying that about 20% of the young people that they had surveyed were not heterosexual, which is like a significant shift from prior generations. And so I think that as queer identities become more common and more celebrated, that we'll also see more people comfortable exploring that part of their own identity and being prepared to ask questions about it while they are in school and while they're learning. This is a quote from Beyond the Basics, which is a resource for educators delivering sexual health education, and it's focused on a human rights framework. And so it's a really good tool if you're having a hard time arguing for the importance of this material in your classroom, because it's really hard for people to argue against human rights. Like, we're pretty supportive of human rights overall. So this one says, while you cannot control the relationship choices of your students, you can provide them with the skills to evaluate and make decisions about the kinds of relationships that they want in their lives. You can provide skills that will help them cultivate more of the types of friendships they want while helping them set and communicate boundaries. You can also provide students with information to determine the ingredients of a healthy relationship. Some of the backlash against comprehensive sexuality education is because people have a poor understanding of what the outcomes of sex ed will be. And so there is this idea that what we could actually has a name, and we call it the promiscuity propaganda, which is basically the idea that if you provide young people with information about sex, that means that they're going to go out and start having sex immediately. And that's actually not true. So this is from some of the research I did in the lead up to my thesis. But we know that young people who receive comprehensive sexuality education are significantly less likely to experience unintentional pregnancies than their counterparts in abstinence-only programs. That common argument is that providing young people with this information about sex is going to lead them to have more or earlier sexual experiences. But that's actually never been proven to be true. And actually, a study that was done in the United States found that in 4 abstinence-only programs, the students in those programs were no more likely to delay their sexual debut, to have fewer sexual partners, or to abstain entirely from sex than students who did not participate in that kind of programming. So there has never been any research that has found abstinence-only programs to be effective. And for that reason, comprehensive sexuality education is the gold standard. So comprehensive sexuality education is an age-appropriate, culturally relevant approach to teaching about sex and relationships by providing scientifically accurate, realistic, non-judgmental information. The term comprehensive emphasizes an approach to sexuality education that encompasses the full range of information, skills, and values to enable young people to exercise their sexual and reproductive rights and to make decisions about their health and sexuality. And that comes from UNESCO, which is the United Nations Education, Scientific, and Cultural Organization. So comprehensive sexuality education is a human right. The UN requires it. So the UN has said that states must incorporate unbiased, scientifically accurate, evidence-based, age-appropriate, and comprehensive sexuality education into their required curricula. Now, I was able to do a deep dive on this human rights specific issue recently, and so I'm going to share a little bit of that because I'm hoping it's as interesting for you as it is for me. In 2018, the incoming government in Ontario made it a political platform that they were going to repeal the sex ed curriculum that was currently being taught in Ontario. And they did that obviously to appeal to their voter base. And so this was like a hotly contested issue. There were tons of protests and organizing by students. There were protests involving parents and educators. And there were people who were vocal on both sides. So what the government in Ontario said that they were going to do was that they were going to repeal the most recent curriculum, which had been created in 2015 and included information on things like sexual orientation and consent, and that they were going to instead revert to the former curriculum. And so they kept saying the curriculum that they were teaching the year before, but the curriculum that they were teaching the year before was actually from 1998. And so you can imagine the challenges and the harms that can be done by teaching a curriculum that is 20 years old and was introduced like prior to the internet being a real influence on young people's lives. But what happened after that was actually really interesting. So eventually the government backtracked and implemented the sexual health education curriculum as it was currently, basically. But Action Canada, the organization, filed a complaint with the United Nations saying that the government of Ontario had committed a human rights violation. And the UN returned a comment to Action Canada and said that, yes, they were actually very concerned and that is exactly what had happened, and that there was significant concern about the state regressing in terms of their delivery of this information. And the reason that sexual health education is so important from a human rights perspective is because it is about autonomy. It is about people having control over their bodies and making decisions for themselves that will determine what their futures look like. And so there is significant concern, especially when we think about the impacts on women and girls when they do not have access to this information. So if you're at all curious, get in touch with me. I'll provide some of the background information on all of the stuff that happened there. But what was most interesting was that when the United Nations returns commentary to Canada, like they don't just return the commentary to Ontario, they actually come back to the national government and they say, what's going on? Your children are misbehaving, essentially. And so Canada then becomes responsible for ensuring that all jurisdictions are in compliance with human rights law. And so I'm very curious to see what that will mean for us in Saskatchewan, because from my personal perspective, the sexual health education that's currently in the curriculum does not meet these standards. Students want comprehensive sexuality education. Research by Byers et al. Shows that between 77 and 99% of students that they surveyed identified topics such as personal safety and pleasure as topics that should be included within sexual health education. And I think that this last statistic is also really important. Parents also want their children to have access to sexual health education. In Ontario, it was a vocal minority who were opposed to the sexual health education as it had been implemented. The province had actually done exhaustive surveys with parents and educators and students prior to introducing the 2015 curriculum. So the idea that like these issues are extremely contentious is actually not accurate. The last time they were surveyed, 85% of Canadian parents are overwhelmingly in support of sex ed being taught in schools. And Saskatchewan, or in the prairie provinces, I think that the stat was 89% in support of sex ed. And at the end, for resources, I'm going to suggest the Canadian Guidelines for Sexual Health Education and a support document that they released called Questions and Answers. And Questions and Answers, I believe, has more information about like which specific topics, even within comprehensive sexuality education, parents believe should be taught. And not surprisingly, pleasure was kind of on the low end of the spectrum, but overwhelmingly lots of support from parents for this information. And this is just an excerpt from the Canadian Guidelines for Sexual Health Education. Sexual health is a key component of overall health, well-being, and quality of life. It is a major determining factor in the well-being of individuals, partners, families, and communities. Furthermore, the sexual health of people in Canada has important social and economic implications for the country. Therefore, the development and implementation of comprehensive sexual health education aimed at enhancing sexual health and well-being and preventing outcomes that negatively impact sexual health should be a public policy priority. Dr. Teresa Tam actually released a statement or a blog post in partnership with Action Canada this week because it's Sexual and Reproductive Health Week. So happy Sexual and Reproductive Health Awareness Week. And her blog post was focusing on youth-led sexual health initiatives. And I think that that's really critical at this particular moment. And honestly, I think that the federal government was well on their way to starting to address some of these issues related to sexually transmitted bloodborne infections, that kind of thing. But the pandemic has certainly derailed some of that work. But hopefully it's something that we'll be able to return to when the pandemic isn't such a looming concern, because none of these things have gone away in the interim. So Saskatchewan has really poor outcomes that are related directly to sexual health. We have the highest rate of HIV infection in Canada. It's more than twice the national average. We also have the highest rate of hepatitis C. We have the highest provincial rate of chlamydia infection, the second highest provincial rate of gonorrhea infection. In 2018 over 2017, we saw a 393% increase in the rate of syphilis infections. We also, for the last 10 years, have had the highest provincial rate of adolescent pregnancy, and we have the second highest provincial rate of sexual violence. So all of those things are clear indicators that we haven't been doing as good of a job as we could be in delivering this critical information. And that has a cost, both a social and an economic cost. So the federal government, I think in 2018, released a document called reducing the health impact of sexually transmitted and bloodborne infections in Canada by 2030, a pan-Canadian STBBI framework for action. And so in that, they cited a lack of holistic, comprehensive, and consistent sexual health education as a factor in the trend of rising STBBI rates in Canada. And that makes sense. And I don't think that anybody would be surprised to see the health outcomes in Saskatchewan if we think about the inconsistency in the delivery and the monitoring of sexual health education. One of the biggest concerns that I have personally with the sexual health education in Saskatchewan is just that it's not being monitored. And so if you have a school and all of their grade 8 students are failing math, we'll find out about that, right? Because there's standardized testing to ensure that that content is being delivered and being delivered adequately. And the same thing doesn't really exist for sexual health education. I've been in communities where administrators have said that no one taught sex ed there for the last 7 years. So you can imagine what happens if no one teaches sexual health education for 7 years. And so I'm not suggesting that standardized testing is necessarily the way to improve the situation, but I do think it would be important for us to look to standardization and some form of monitoring and evaluation to see where we are at as a province. So sexual health education in Saskatchewan lives within the health education curricula, and it's first introduced kind of around grade 5 and then continues into about grade 10. And one of the biggest challenges that I have with it is that it is framed from a abstinence perspective for educators right from the get-go. So one of the introductory paragraphs to the sexual health education content says, sexual health is a major part of personal health and healthy living. Human sexuality research emphasizes abstinence from all sexual activity involving risk as the best and healthiest decision for adolescents. Research also indicates that students who decide to become sexually active now or in the future need information about effective protection against pregnancy and sexually transmitted infections. I think that that's just such a problematic way of introducing the topic because abstinence from all activity is obviously going to be the safest and least risky decision, right? Like not driving a car is the best way to not get into a car accident. But driving cars and crossing the street and riding bikes are all elements of a normal human existence. And so we are taught skills to negotiate and to navigate and to reduce some of the harms that may occur in those kinds of situations. And so we should take the same harm reduction approach when we are talking about sexual health. It doesn't even, to me, it doesn't make any sense to say that not having sex is the safest way to have sex. Like, I think that we are well beyond the time period where that was an appropriate response to this kind of information. The health education curriculum is also missing topics. It's missing sex positivity, elements of empowerment, talking about gender equity, diversity and inclusion. There are some documents that speak to diversity and inclusion, but they are kind of like an appendix or a separate kind of like information package to the health curriculum. Accuracy and evidence. So with the way that the curriculum is currently structured, they're not providing any evidence for this information. So I would be curious to see which human sexuality research actually emphasizes abstinence, because as I mentioned, there have never been any studies that proved that abstinence-only education was effective. Comprehensive. Straight up contraceptives are not currently in the health education curriculum. They talk about ways to avoid pregnancy, but not contraceptives specifically. You can see how in a particular school where an abstinence focus is really important, how that would allow educators to not provide information about contraception. And the last piece is consent. So in terms of like what students are thinking about and wondering wanting to talk about, we have to have a better understanding of like what sex is and what it means to them. So this is from some research by Byers, Henderson, and Hobson. And I love it because it's speaking to this idea already of sex being so complicated. And actually, I would love for people in the chat, do you all have access to the chat? Savannah, let me know, to tell me what you would consider to be sex. So is it number 1, manual genital touching? Is it number 2, oral genital stimulation? Number 3, penis vagina sex? Or number 4, penis penile anal intercourse? Oh, I got some all of the aboves, some all of thems, all of the above, right? And so again, historically, when we talked about sexual health education, it was just like really focused on penis and vagina intercourse. And so that made young people think that there was no risks to any other things, right? And some activities have more risks than others do. But for example, being able to have conversations about oral sex is also really important. The rate of the human papillomavirus, or HPV, in adolescent populations is skyrocketing, and specifically in terms of getting HPV in your throat. And this is actually really problematic because HPV infections in your throat can lead to cancer. And so the World Health Organization actually thinks that by the year 2030, the leading cause of throat cancer is going to be HPV. And so that's partially why the vaccine was introduced. But what that also means is that it's really important for us to be able to talk about oral sex as a form of sexual expression and pleasure, but also as something that carries potential risks, because as soon as that risk of pregnancy disappears, then all of a sudden all of the other risks fall away. And so it's really important that we're learning to have these conversations. And someone said, whatever the people involved define it as, outside perspective seems irrelevant. And that's also the case. I get lots of questions from young people about like, does this count as sex? Or how do I know if I've had sex? Or how do two girls have sex? And that's such a challenging conversation to answer. I usually say, you know, sex is about pleasure, and it's usually about people's genitals. And so it's usually about touching your own genitals or touching other people's genitals, or your genitals touching in a way that feels pleasurable, but not every couple does it the same way. And so we also need to remember that for students who are not heterosexual, like maybe anal sex is going to be the main sexual experience that they have. And so it's really important that we're also not creating a hierarchy in terms of these experiences and the importance of one over another, and that we're instead able to acknowledge all of them as experiences of sex or sexuality. So there's new data on sexual behavior among teens, and I just love new data. Let me tell you, new data on sexual health in Canada is hard to come by. It is notoriously difficult to find information about sexual health and the sexual health or behaviors of young people in Canada. It's not as widely studied as it is in the United States. And I think that even though the United States and Canada have lots of similarities, they also have lots of differences. And so having this data for Canadians is really important to me. So what we're looking at is a table of sexual behaviors amongst adolescents in Canada by age group. And so this research has mainly been done by, I believe her first name is Michelle Roderman, and then the most recent version, Roderman and McKay. And so they have been surveying young people and asking them about their sexual behaviors. And so what this table is reporting is percentage of the teenagers that age who have had sexual intercourse. And prior to the 2015-2016 survey, sexual intercourse was defined as penis and vagina sex. In the most recent iteration of the survey, they also included anal sex in their definition of what sexual intercourse was. So to me, this is fascinating. The one thing that I use this table for is to remind people that even though we have this tendency to think that more young people than ever are having sex, that's actually not true, and it's never been true. The age of sexual debut has hovered around 16 years old for like the last 60 years. It's not really, it hasn't changed very much. And what we're actually seeing is that the age of sexual debut is getting later in life than it has been for previous generations. So you can see that amongst 15 to 17-year-olds, when surveyed in 2009, 2010, 30% indicated that they had already had sexual intercourse. In 2015, 2016, that went down to 23.3%. Now, I'm sure like all of you, I will be fascinated to see what happens when we report on the 2020-2021 data and how a pandemic impacts sexual experiences. But that number has actually decreased significantly from my perspective. If we look at the group of 18 to 19-year-olds, 68% indicated that they had had sex in 2009, 2010, and that was down to 57.6% in 2015, 2016. Now, another thing though that we need to think about is that this table is specifically measuring penis, vagina, or anal sex. And for some young people, those are like heavy hitters. And so they consider that to be like real sex, and they might consider things like mutual masturbation or oral sex to not be real sex and to not count, right? And so I would be curious to see research on a Canadian population in terms of behaviors more exhaustively, including oral sex, and whether or not that's something that's become more common or more prevalent. Going through a pandemic, I also expect that we would see an increase in behaviors related to like sexting and sharing nude photos among the population because they haven't had other opportunities to explore their sexuality. And those things specifically actually don't carry some of those risks that we're used to talking about. So those things like STDs and pregnancy, right? You're not going to get pregnant from sending a nude. That doesn't mean that there aren't other risks to consider though. Any numbers on masturbation rates? I don't think so. I would love to see them though. I do have some of that information. I believe there was a study, I think it was in 2007, called the Toronto Teen Sex Survey. And I think that that one probably has some information about things like masturbation, but I'm not 100% certain. So I also wanted to include this information on condom use, and that's because that was my initial idea when I was researching my thesis, was why do young people not use condoms? And what I've learned through all of this exploration and research and reading is that pregnancy and STIs are not the only risk that young people face when they're exploring their sexuality. So they have to think about social risks, emotional risks, and physical risks and consequences all at the same time. Condoms are really, really complicated. I know it's just like a little piece of latex. It's not that big of a deal. But like anyone who's ever tried to hand out condoms at like a health fair understands that people's reactions to them are widely varied and often not the most positive. And that's because condoms imply a lot of different things. They imply that someone is sexually experienced. They imply that someone's untrustworthy. They imply that you're suspicious of your partner, that you don't trust them. They might imply that you're planning on having sex. If you're planning on having sex, that means you were thinking about having sex, and what kind of person thinks about having sex, right? And so all of those really nuanced ideas are things that young people have to negotiate when they're talking about condom use. And what that ultimately means is that power is also a major factor in whether or not they're going to be able to negotiate safer sexual practices with their partners. But encouragingly, young people in Saskatchewan were more likely than young people in any other province in Canada to report condom use the last time they had sex in the research that was collected in that last survey by Roderman and McKay. And when I got the call from CTV, I hadn't read the study yet. I didn't know it was out, and they called and they were like, "Can we interview you on the fact that young people in Saskatchewan use more condoms than anybody else?" And I was elated, because I think that that's something that we've been working on really hard collectively as a province for the last few years, trying to address those really high STBBI rates. And I don't think that the battle is won. I think that that's something that we're going to need to continue to focus on. But I think that that is really promising news, and I definitely found that encouraging. So to all of this, and I'm sure I've emphasized it time and time again now, but sexuality is really complicated. Conversations about sexuality and relationships are inherently conversations about power. This means that we also need to be prepared to discuss things like sexism, heterosexism, cissexism, ableism, racism, and classism to better understand the experiences of our students. I just had this kind of like epiphany, if you will, while I was working on my research recently. I was really fixated on the power dynamics that are present in heterosexual relationships, and like the power that's expressed through masculinity and through femininity. And so most of my research and my reviewing had kind of been on that specific topic. And then I just came to this realization recently that it's not just gender and power for young people. You know, it becomes race and power. It becomes sexuality and power. If you look at like the health outcomes related to sexual health for bisexual young people, they tend to be much poorer than the rest of the population. There are reasons for that, and it does come down to the power in relationships, being able to negotiate with your partner. One of my favorite studies that I came across in my research was one on condom use and relational commitment. So they were basically asking young people who were in like either highly committed relationships or not highly committed relationships what their reasons were for not using condoms. And in the highly committed relationships, they would say things like, I trust my partner, I feel comfortable with them, blah, blah, blah. And that's why they were not using condoms. And then in the non-committed relationships, they would say things like, I'm worried that if I asked them to use condoms, that they wouldn't want to have sex or that they wouldn't want to see me anymore. And so you have people who are on completely different ends of this relationship spectrum, but both are struggling to negotiate condom use because of the power dynamics within their relationship. And so it's not as simple as just providing the condoms or telling young people to use them. It's about helping them negotiate these conversations with their partners, and to also, you know, better understand their own agency, their own boundaries, so that they feel empowered. All right, so how can I be a better sex ed teacher? And I mean that for myself too. Like, this is a constant improvement situation. So the first is thinking about redefining what effective means to us. Lots of the research that I read indicated that effective was often defined by adults and what we thought effective looked like, right? And so that's going to be a reduction in teen pregnancies and a reduction in STBBI rates. And of course, those are things that are important and that we want to see, but that's not necessarily what students want and need to learn about, or those certainly aren't the only things that students want to, and need to learn about. So it's really important that we also appreciate their knowledge and their experience, that we're letting them be the leaders and to guide some of these conversations, because effective could also look like students having the skills to like have healthy relationships. It could look like them having the skills to leave unhealthy relationships. It could look like them having the skills to have pleasurable experiences, but those often aren't the metrics that we're thinking about or prioritizing. Lots of the research would also indicate that the success of sexual health education is dependent on the delivery, and the energy that the educator is bringing to those lessons. And so it's important that we try to stay open, candid, I would say curious, and comfortable when we're broaching these conversations. And I know the comfort thing is so challenging, right? Because you're standing in front of a classroom of students talking about things that are deeply personal and challenging people's views and beliefs and value systems. But I think that the openness piece is the most important. So just the willingness to engage and have these kinds of conversations. And then the last piece is be prepared. So planning to cover a wide range of topics, talking about sexuality without discussing desire or pleasure denies critical information to students. And I think that that's so important. This is something that I still struggle with and being able to incorporate into my lessons because you say that you're going to talk to people about sexually transmitted infections. They're like, oh yeah, so important, go ahead. But if you're like, I'm going to talk to the kids about having pleasurable sexual experiences, they'd be like, whoa, that's too much. They don't need that. And young people know that people have sex for reasons besides reproduction. I often ask that, especially with students who are younger. I'll say to like a grade 8 classroom, why do you think that people have sex? And they say, to have babies. And then I'll say, is that the only reason that people have sex? And they're like, no. And they know. And so it's really important that we are able to discuss a desire, that we're able to discuss pleasure, because that sets young people up to have better experiences. Like, I truly think that if we spent more time discussing pleasurable experiences and the importance of that, we would really easily see a reduction in things like sexual violence rates, in things like STBI, etc., because we're teaching students to be good partners and to be focused on themselves and their own bodies and their own experiences, but also to be focused on the other person. And I think that in a lot of different ways, that conversation around pleasure is one of the best possible tools that we have, although I would argue maybe one of the more challenging to implement. Okay, so these are some tips. Someone said, so true, people don't just eat to fuel their bodies, right? Yes. And oh, the thing that I forgot to say just there was that pleasure is a human right. Wow, do I love to repeat that time and time again. Pleasure is a human right. Young people have a right to have pleasurable experiences, and not providing this information ends up being a human rights violation. So like, let's make sure that they have all of the information that they need to make decisions about themselves. There's a really great TED talk by Peggy Orenstein, and I love Peggy Orenstein and her work, and it's on young girls' sexual experiences. So she's actually interviewing college students about their sexual experiences. And she found that through the interviews, they were reporting that they had good sex lives, basically. But when she was like hearing more about the kinds of experiences that they were talking about, she was not perceiving those to be good experiences. And so she ended up doing some research on how these young people were defining what good experiences were. And the three kind of key metrics that the young women were using to determine whether or not their experience was good was, did it cause any pain? Did I feel connected to my partner? And oh, now I'm not going to be able to remember the last one. Oh, I think it was like, did my partner enjoy themselves or like have a pleasurable experience? And that is not a good metric for whether or not you personally had a good sexual experience. And so I think that that conversation, it's a TED talk, it's on YouTube, you can go watch it, and I would really recommend it. But she gets into some of the harms of not providing this information around pleasure, and what happens when we deny people, young people, agency over their own experiences and over their own bodies. Okay, so these are some tips to become an askable app. These are tips to become an effective sexual health educator. Sorry, her name is Peggy Orenstein. She has a book called Girls and Sex. I think I have it here, but I'm going to pull down a whole stack of books if I try to get it. And then she just came out with a new one called Boys and Sex, which I haven't had the opportunity to read yet, but I'm very much looking forward to. So the first of the tips is become an askable adult. So become that person that's willing to engage, to have the conversations, to be open. If you're a classroom teacher, these don't just need to be conversations that happen within health. You know, these ideas, these topics, they come up in other subjects. And so being willing to like reflect on it constantly and engage with that information is really important. Second piece, don't panic. There's been a number of occasions where I have had a administrator or an educator call me like very upset because something has happened or a student has said something in the classroom. Now, the way that we react to young people tells them a lot about what our approach to this kind of conversation is going to be. And so I think that it's really important that if you do ever get a question that is unsettling or startles you, or you just don't, catches you off guard, just say like, hey, great question. I'll get back to you. And then do get back to them. Take your time, gather a response, call me if you need some tips, whatever. But try not to panic in that moment and say like, oh my God, why are you asking that? Why would you do that? The next is ask questions yourself. So being willing to engage with students and ask them questions about what they're thinking about or experiencing. Like before you start your sex ed unit, ask them what they want to know, what they want to learn. There's stuff in the curriculum that we have to cover, but they might be curious about lots of other topics, and that helps to create a good game plan for what you're going to talk about as a class. Keep answers accurate, honest, short, and simple. This is like more a tip for parents, but I think could be applied for teachers as well. So my rule is that if someone has the wherewithal to ask a question, then they deserve an answer to that question. And if you don't answer it, the internet will. And the internet's not as generous or patient as we are or can be. So if a young person asks something about like what sex or where do babies come from, that doesn't mean that we need to start like going into this elaborate conversation about oral sex. But it does mean providing accurate, honest answers to the question and just addressing the question that's been asked, not making it into like a big thing. And most young people are really satisfied with just like a straightforward and direct answer to their question. Remember that normal changes. So one of the times I got a call from an educator, and he was like, oh my God, all the kids are sending nude photos to each other. Like they need to know that this isn't normal. And my thought was, well, you just said that they're all doing it. So if they're all doing it, then that's what normal is. And normal changes. What was normal for me as a high school student isn't what's normal for high school students today. Each generation discovers sexuality in a different way through a different means. And so instead of getting hung up on whether or not things are normal, focus on what's actually happening with the young people and talk about it. Use teachable moments. So when there's opportunities to have these conversations in other places, then I think that that's worthwhile. A few years ago, a lot of students had watched the TV show 13 Reasons Why, which had a character who committed suicide kind of as a result of trauma from sexual violence. And so I knew that like lots of students had watched the show. So I also watched it just to be prepared to have that conversation and to answer those kinds of questions. And so again, these conversations don't always need to be fixed within the health curriculum or health lessons. They can show up other places as well. You don't need to have all the answers. I don't have all of the answers. Not having answers to questions is very human. And I think that it's important that young people recognize that like there's no level of sexual expertise that's ever going to be reached where they all of a sudden are going to have all this information or have all the answers all the time. These things are tough, they're complicated. And so I think that it's an important show of humility. But also a good way of demonstrating how to like get information for you to say to a young person like, hey, that's a really great question. I actually don't know the answer, but here's who I would ask, or this is where I would go to find out this information. And then like you can look for the information together and figure out whether or not, this website is trustworthy for information, or whether or not it would be better to call a clinic and speak to a nurse. Humor is your best friend. Sex is awkward. Sex makes people feel nervous and uncomfortable. And it is funny sometimes. Acknowledging all of those things, embracing that awkwardness is one of the things that I find to be most effective in delivering this kind of information. And the last piece is use a question box. And so question boxes are really valuable because they're a way to interact with students anonymously and let them ask their questions without being worried that they're going to be identified. I'm not like in a classroom 100% of the time, so I kind of just show up and then take off. So I usually bring my question box with me, but I will often encourage teachers to have the question box set up for like a week before the lesson or a week after the lesson to give kids time to think of questions, to add things as they come up. And then the benefit for using a question box as an educator is that you can look at the questions, take some time to find the answers to them, and then deliver them in a way that feels appropriate and comfortable for you. So we've got like 20 minutes. These are some self-reflection questions. But for the first one, no, I think I want an answer to question number 2. So in the chat, go ahead and tell me, if you're a teacher, think about the students that you're teaching, and then think about yourself at that age and like what was the information that you desperately wanted, or what are the things that you would have wanted to learn about in sex ed when you were that age. How ovulation works. Cool. I love that. Sorry, I always have to ask questions so that I can like stop and have my little coffee break. Consent and pleasure. Yeah, absolutely. One of my favorite like aspirational educators in sex education is BK Chan, and BK talks about like people assuming that kids want to learn about intercourse or STIs or whatever, and then after surveying them realize that they actually just wanted to know about like how to kiss, right? And like I don't think that in teaching sexual health education I've ever done a lesson on like how to kiss or even like given lots of thought to it. But for like a student in grade 6 or 7, you can imagine that kissing is the big thing that they're thinking about right now, not necessarily about intercourse. Some other people said what a good relationship looks like, how to have conversations about sex, queer sex ed, what is sexual desire, how will I know when I want to have sex? And I promise you that's a question that young people still have. Everybody always wants to know how they're going to know when they're ready to have sex, or how they'll know when they want to have sex. Someone else saying that they were just incredibly curious, wanted to know and talk about everything. I wanted serious information to be treated like I could have these conversations, right? And yes, that was lots of the research that I found as well, is that there's some research by Louisa Allen, and she does her research in New Zealand. But I think like context wise, New Zealand's actually pretty similar to Canada. And one of the things I appreciated about that research was just this emphasis on young people as sexually knowing beings, and the fact that they do know lots about this stuff, and that it is their body, it is their experience. And so it's really important that we treat them respectfully in these kinds of conversations. Someone said when sex ed was taught, they only ever talked about 28-day cycles. That's really funny. I hope you mastered it, because I sometimes am not super clear on exactly how the menstrual cycles happen still. I wanted definitions to things I heard in the media and from older relatives, also about masturbation and queer sexuality. Somebody else saying fertility is not well covered at all. See, that's what happened to me. Although I think that like fertility is something I still don't cover as heavily as I probably could. More detail about the menstrual cycle, information about embarrassing things like discharge, nightly emissions. Savannah, I love that you said nightly emissions. I have something else that calls them nocturnal emissions, and I just love that so much. Wet dreams, if you're not reading a scientific textbook. Same-sex knowledge. The New Zealand researcher's name is Louisa Allen. Somebody wanting to know weird stuff like what's an orgy or a fetish. Other words I heard older people say. Um, one of my like absolute favorite conversations that I've ever had is that a while ago, a friend and I were like having a conversation about the difference between kinks and fetishes. And I think at that time I didn't like have a really clear understanding of the difference. And so I had been joking about it just for like a few months. And then somehow in my question box ended up with a question one day that said, what is a kink? What is a fetish? And what is the difference? And I almost died in the classroom because I'd just been like saying that question out loud so much to myself, like kind of as a joke. And then somehow it just ended up in the mind of a young person. Somebody else saying self-pleasure options, one-on-one conversations with sex educators. Wouldn't that be an absolute treat if we somehow had enough time for each kid to be able to like sit down and have a conversation and ask all the questions that they want? I think that does speak to the power, though, of being able to involve parents in these kinds of conversations. If you do research with young people about who they want to learn about sex from, the number one person that they'll say is their parents. And so I think that there's a really critical place for parents in these conversations. Sexual health educators and classroom teachers can be really good at, delivering content and information, but we also have to remember that values and those kinds of things come from home. And so ideally, young people also have somebody at home that they can talk to. And it might not be their parents, it might be like cook 'em or mush 'em or an aunt or uncle, or even like another kid's parent, but having multiple places to have these conversations is important. Someone saying that it may not be pleasurable in the beginning and that's okay. Don't hold expectations for yourself or experience. Yeah, super great point. It always confused me that they never addressed what to do if you decided not to abstain and found yourself pregnant, or if you had an infection. That sounds like it was probably an abstinence-focused program. I would have loved to know that masturbation, watching porn was okay for a girl also. Yeah, these are also great. Sorry, I'm reading them all because I just enjoy them. I was doing a presentation to a group of students at the YMCA actually, and one of them said, we were talking about masturbation and like blah, 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 whatever else. And I thought this is like a pretty standard conversation. And this girl looks at me and she was like, what? And she goes, you mean girls can masturbate? And I was like, yeah, definitely. And she was like, are you serious? And her mind was blown. I wish you could have seen her face because she was like 14 and had no idea that girls could masturbate. Safe person to talk to comfortably. Someone said that they are a counselor and got to do CSE with grade 9 to 12s and had lots of one-on-one follow-up as a school counselor. That's so awesome. I would love it if you got in touch with me and told me more about how you're able to make that happen, because I think that school counselors can also be a really critical piece of this conversation. And somebody else saying, I remember how awkward it was and I really wasn't ready to have those conversations then. I needed them later in university. And that's a super great point too. Ideally, what we're doing is a scaffolded learning, like I mentioned earlier. So that we're starting the conversations really young and we carry them on as young people are getting older. So like hopefully they feel more familiar and comfortable with the conversation, but it also means returning to these ideas time and time again. I usually say that like if you've got a classroom of grade 7 students and you're talking about puberty, and I'm speaking from experience here, you've got like half of the class, their parents have talked to them about puberty, they know what's up, they can like name anatomy, and then you've got a couple kids who are just like still talking about Pokemon. The kids that understand will understand. The kids who don't understand, it usually goes over their heads. And so I think it's important that we're teaching to the kid in the class that needs the information the most, and making sure that we are providing that information, even if there are discrepancies in levels of understanding amongst the students. And then somebody else said, I was irritated that they split us up by gender, so the boys knew less than nothing about menstruation. Yeah, that's another really good point. I still struggle with this one sometimes because girls' phys ed classes and boys' phys ed classes are still gender segregated today. But when I can, I really love to combine both of those classes together because I think that everybody needs to have the same information. If you're heterosexual, you're going to be having sexual experiences with somebody of the opposite sex. And so you need to be able to understand their experience as well. I think that having everyone in the same classroom also makes it easier to talk about make it easier to talk about same-sex relationships and those kinds of experiences without, like drawing attention to any one particular kid in the class. Because as soon as you have a segregated class and then someone asks a question about like, oh, how do girls have sex with girls? The class can kind of like really quickly figure out who's asking those kinds of questions and stuff. So I do appreciate being able to teach inclusive classes all at the same time, but it's not always possible. Although someone here is saying that their phys ed classes aren't gender segregated in high school. As far as I know, I think that some of them still are in Saskatoon, but I could be wrong about that. I haven't set foot in a classroom in close to a year now. Oh, and then someone saying, just because you're not homo or heterosexual, it's important to know and understand about others. Yes, exactly. Also, conversations about like anal sex aren't just conversations that are reserved for queer students. Those are experiences that lots of students will have. And then also saying disabilities are another area that's not covered. And yes, I agree wholeheartedly to that. I work for Saskatoon Sexual Health, and we actually have a disability sexual health and wellness program for learners with differing abilities. And we do that in partnership with with Inclusion Saskatchewan and Creative Options in Regina. And that's a really incredible program, if I do say so myself. All of those resources are online. I'll just put the website here so you can check those out. And we actually just released a new participant workbook, which is exciting. But I absolutely agree that disability isn't something that is ever presented in traditional sex ed. Okay, so these are just some resources that I have to recommend for you all. Oh, also someone said normalizing menstruation for trans and masculine folks. Yep, exactly. And then somebody also saying that some gym classes are still segregated. Oops, sorry, I'm just typing to panelists and not to panelists and attendees. Thanks, Savannah. So these are some resources that I would recommend. Action Canada for Sexual Health and Rights. They're a great organization. They actually do the majority of organizing around Sexual and Reproductive Health Awareness Week for Canadians. So they've got a really great campaign right now, and there's campaign materials that you can request. They have really cute posters and also social media tools. They have a book called Beyond the Basics that you can purchase from them that's about teaching sexual health from a human rights perspective. They also have a document called the State of Sex Ed in Canada report, and that is on their website. And so they did some research on the sexual health curricula across Canada and reviewed each of them. And I actually was able to help them do some of that research in 2018. So I was glad to see that report published earlier this year. Unsurprisingly, it kind of concluded that sexual health education in Canada is substandard and like poorly implemented. Pleasure Pie has resources for educators and activists. I really like the resources that they have on there on like framing different conversations. So they have stuff on like how to have a conversation about healthy relationships, how to have a conversation about STIs, that kind of thing. The Prevention Institute, of course, they've been doing such a fantastic job in providing us professional development opportunities and learning opportunities. They also have resources that they've produced themselves, and I'm sure that Savannah will speak to that. The Sex Information and Education Council of Canada, CCAN, they are the ones that produce the Canadian Guidelines for Sexual Health Education, which is kind of like our guiding document. And then they also have that second document that I mentioned, which is the questions and answers. And I think that that one's a really fantastic read. It's like, has questions like, oh, do parents support sex ed in schools? What do students want to see, and then answers and like data for all of that stuff. The United Nations Population Fund, they have a document called the International Technical Guidance on Sexuality Education. That's kind of the Bible. If you're a big sex ed nerd, then by all means, like read that and delve into it, but it's like 500 pages. I have not read the whole thing, but that's kind of like foundationally what the Canadian guidelines are adhering to in terms of a standard for delivery. And then the last one there is teachingsexualhealth.ca, which I mentioned is an Alberta-based resource. And it's got lots of like lesson plans for teachers and other helpful information, some Kahoot quizzes, that kind of thing. And then in the chat, actually to everybody this time, I will also mention, oops. I'm sorry, I do see that there's 2 questions, but I'll get to them in 1 second. So saskatoonsexualhealth.ca/resources has lesson plans for teaching healthy relationships, sexually transmitted infections, and birth control, and also some additional anti-racist resources that we came up with, some inclusive language resources, sexual health at a glance in Saskatchewan, lots of helpful stuff there. We also have Kahoot quizzes and a YouTube account with videos explaining how to use condoms. If there's ever something that you would like to see there, you would think would be helpful, you can definitely get in touch with me, and I'd be happy to include that. And then the other website that we have that was recently launched is sexlifesask.ca, which is a provincial website that's kind of a hub for information about sexual health overall. So STIs, contraceptives, that kind of thing. Okay, and my email is there in case anybody has any questions or they wanted to get in touch. Ooh, the long book, 500 plus words. Yes, that is the United. I believe that's the actual title. I should have grabbed a link for you there, but you should be able to Google it pretty easily. Okay, the questions. Will the slides be sent out? Yes, absolutely. I am happy to send out the slides. I will provide those to Savannah. And I saw that Savannah also answered the TED Talk person, which is Peggy Orenstein. And then someone said, I've worked with a PHN and her presentation used tactics such as scaring the students with such information on HIV or STIs. How do I approach her and ask for her to be more open to all conversations? Okay. That is a tough question. On one hand, it's like exciting that you even have access to a public health nurse because they're not as present in schools as they used to be. But I think that just even like referring to the Canadian guidelines and like looking at some of the outcomes and indicators that are in there and are framed as important would be like a good starting point, I guess, like saying, hey, I just recently had the opportunity to look through these new Canadian guidelines. I think they're so fantastic. We're doing a good job talking about risks and consequences related to STIs, but how can we make sure that we're also balancing that with sex positive information to make sure that young people have all the skills that they need to navigate this conversation. And hopefully that would help to shift it a little bit. But if there's like a whole series of people that are a whole group of people delivering that content in a similar way, then maybe it's an issue that needs to be addressed with the organization that they're coming from. I've worked a little bit with some of the public health nurses in Saskatoon on content for presentations and that kind of thing. And lots of times they might have to deal with a little bit more bureaucracy than I do working at a nonprofit. And so I've usually found that we're able to like meet a balance in delivering that information, but just being able to have a conversation and talk about some of the outcomes that you would like to see, I think would be a good way to start the conversation. Someone said, any way we can help influence policy or school curriculum. So I think that speaking to administrators at school, asking what is being taught, if you've got like your own kids, learners, speaking to their teachers to ask when these lessons are being delivered, asking about what the content is going to be. We do have a forum letter that I'm going to be putting onto the website pretty soon that you can also send to an MLA to ask for comprehensive sexuality education to be included in the health curriculum, because it's actually not currently. And again, just referring back to the Canadian guidelines, that UNESCO technical guidance, if you really want, I can provide you with the specific human rights framework related pieces as well, to just emphasize that this is not a conversation that's up for negotiation, that there are actual standards that need to be met. And then someone else asking if we have an Indigenous elder or advisor at the Saskatoon Sexual Health Center. We don't right now. And honestly, that's something that I would love to have available for people. We don't have a really massive staff. There's actually only, I think, 5 of us that work full time. But one of the things that we are looking forward to is that we've got some additional funding to look at our sex ed and do some indigenization and some decolonization work on the presentations that we currently have. And so we're going to be working with a really fantastic consultant on that. And hopefully that'll influence the way that we're able to deliver this material over the next however many years it's necessary. I see that it's 11:32, so I've run over as I always do, but I'll leave it there.
Thank you so much, Natalia. That was an amazing presentation. I think everyone here really appreciates the time that you've taken to share all of this with us. Just before we finish up, I'm going to share a brand new resource that we've created at the Saskatchewan Prevention Institute for Educators. It is the Sexual Health Information for Educators webpage. I will share a link to this. It includes information on comprehensive sexuality education. And also my favorite part about this page is that it includes downloadable resources for educators that are separated into different age groups. So we have early elementary school years, we have middle years, and older years. And each of these documents represents the curriculum outcomes that are relevant for sexual health education and recommended topics that might not be addressed, but are age appropriate. We also link all of these topics to really helpful resources from around Saskatchewan and throughout the country, as well as some international resources as well that you can use in your classrooms. So I will share a link to this webpage with everybody in a follow-up email. So really excited for that new thing. I would also like to share the next Teaching Sex Ed webinar that we have coming up. It's on facilitation skills with Dr. Nadine Thornhill, who did a webinar with us earlier in the fall. She is the co-creator of Everybody Curious, which is a really great resource as well for kids in the middle school years. And that will be on March 23rd at 11 a.m. I will also be giving away a copy of Beyond the Basics from Action Canada for Sexual Health and Rights to someone who has attended this session today. So here it is. This is the book that Natalia was mentioning throughout this presentation. It's a great resource. And there's also a partner resource that has activities and different things that you can use in classrooms. So before we close this window today, you'll be after you close it, I guess, you'll be directed to a link where you can complete a short survey evaluation of this session. Completing these evaluations helps us create programming and resources that can support you in your work. So we really appreciate the time that it takes to complete them. Natalia, is there anything else that you'd like to share with us before we end the meeting?
I don't think so. There's some people in the comments that are like asking specific questions. Just shoot me an email and I'll be sure to get back to you there. I see the one about the abuse and trauma. And yeah, I'd be happy to answer that question. I'll just send an email.
Perfect. Thank you so much for joining us today. Happy Sexual and Reproductive Health Week, everyone.
Yeah, you too.
Take care.